for COVID-19 community engagement request for services. And just a note that this session is being recorded and will be captioned and posted on our Request for Services webpage. And from now on, for the rest of the presentation, I will be referring to Request for Service as RFS. And a couple notes about technology. Just make sure that you're muted while others are speaking. And we do have a team of wonderful ASL interpreters today, Margaret and Patty. And so in order to be able to see both of them, or one of the ASL interpreters, while also seeing the slides, you just have to go to your upper right-hand corner and switch the layout to side by side. And I also included those instructions in the chat to be able to see both the slides and the interpreter. And then as we are going along, if you have any trouble hearing me, please let me know. Sometimes, when I'm sharing my screen, I don't always see the chat immediately, so feel free to speak up and unmute and let me know if you're having trouble with audio. And we are gonna get started. So this request for services is being issued by Minnesota Department of Health, MDH, and MDH has created special teams to work on various aspects of our COVID-19 response. And these contracts will be part of the work of the MDH COVID-19 Cultural, Faith, Disabilities Community Engagement Branch. And the Cultural, Faith, and Disability Communities Engagement Branch is led by Danushka Wanduragala, and Ann Lindy is the deputy. Chelsea Huntley is the chief of the entire COVID-19 Local Tribal Community Health Partners section. And this section does include our Cultural, Faith, and Disability Community Engagement Branch. And then within the branch, we have our contracts team. So Bridget Roby is our contracts lead, and Meredith Algren is the deputy. And my name is Ramya Palniappan, and I am one of the leads for this community engagement RFS. And Bridget, Ann, and Meredith are also on the call today and will be helping answering questions along the way. So today we are really gonna go over the key components of the RFS. And as you have questions, please put them in the chat box and we'll compile them as they come through. And at the end, we'll start answering the questions one by one. And if we don't have time to get to your question, we will post the response on our webpage. So regardless if we don't get to it today, you will see a response on our webpage. And so here is our webpage. This link is to the Community Engagement RFS webpage, and this is the main page that you'll go to find an overview of the RFS, the templates, link to our frequently asked questions, and other information about the RFS. And the picture here is of our main webpage, and this gives you an overview of our contracting work and past contracting work and past partners as well. Okay, so just to get started, this RFS is really designed to engage communities around COVID-19 vaccines, testing, case interviews, contact tracing, and other COVID-19 topics. And we ask our respondents, our contractors, to use culturally relevant, linguistically appropriate, and timely community engagement activities to learn more about community questions and needs related to vaccines, testing, and other COVID-19 topics. And we ask that respondents work with the state and partners to address these community needs. And we do really encourage applicants to use a trauma-informed lens to approach this work. And so our primary populations are the following communities within Minnesota. So African American, African immigrant, American Indian, Asian American, disability, Latinx, LGBTQ. And we do approach this work with an intersectional lens. So we really do encourage organizations to reach diverse communities within communities of color and American Indian communities, so such as people of color and American Indians with disabilities, and people of color and American Indians who are LGBTQ. And so the final selection will include a competitive review of proposals, and the selected contractors will cover a range of geographic areas and reach the priority populations that we mentioned in the slide before. And the state will prioritize entities that are led by people of color, American Indians, people with disabilities, and/or LGBTQ individuals. So the timeline for the RFS was released yesterday afternoon, and it'll be open for 2 weeks. So it's due Monday, December 28th by 11:59 p.m. And the deadline to submit questions is Tuesday, December 22nd by 5 p.m. And the reason we have this deadline for submitting questions is really to make sure everyone who is applying has access to the same information. And the deadline is on the 22nd to give our staff enough time to post the response to our FAQ website before that holiday weekend. And when you email us questions or ask us questions, our staff will have the response on the FAQ webpage within 1 business day. So please check that website, the FAQ webpage, to see the responses to your questions and to see what other people are asking as well. And then in between the proposal being due and an anticipated contract start date, we will be processing the applications. Reviewers will be reading and scoring the applications, and will hold review committees and make final funding decisions. And then there will be a negotiation process for the selected contractors. So our anticipated contract start date is early February, and anticipated end date is the end of July of next year. So the overall goal for this request for services is to increase community understanding and engagement around COVID-19 vaccines, testing, case interviews, contact tracing, and other COVID-19 topics among residents of Minnesota and the 11 tribal nations that share its geography, particularly residents from communities of color, American Indian residents, LGBTQ residents, residents with disabilities, and residents with limited English proficiency. So who is eligible? So this RFS is intended for community-based organizations and tribes, and we are estimating 1.5 million available for multiple contracts, and we're asking proposals between 10,000 and 75,000. And again, these proposed plans can engage 1 or more communities and 1 or more geographic areas. And just a note that the request for services is contingent on funding availability. And also please note that lead organizations funded by MDH or DEED through COVID community coordinators are not eligible to respond to this request for services. So MDH, we recognize and acknowledge that our communities most impacted may experience significant barriers and hesitancy, especially around COVID-19 vaccines and testing and other COVID-19 topics. And so we're really asking interested responders to share ideas for how to increase community understanding around vaccines and testing, and encouraging community members to get vaccinated and tested as appropriate, and working with MDH and other partners to share information and be connected to these resources. And so these are sample responsibilities for selected contractors. So first would be working with the state to finalize a work plan, and then using existing networks, community or tribal leaders, faith leaders, community health professionals, and others to engage communities, and then coordinating with the different partners and other entities that are providing vaccines and testing, case interviews, contact tracing, and wraparound services. And then working with MDH and other partners to address community needs related to COVID-19, participating in a biweekly call to receive updates and go over any questions or needs, and strategize for more ideas, and then prepare brief reports just summarizing what work has been done. So now we're going to move on to the response and submission requirements. So interested responders should fill out the proposal submission form, and this can be found on the Community Engagement RFS webpage. So that was that webpage that we showed in the beginning. And once you submit this form, you'll receive an automated confirmation email. And you should reply to that email and attach the supplemental materials. So note that you have your submission form and your supplemental materials due by that December 28th deadline by 11:59. And so there's, again, 3 things due: the proposal, submission form, work plan, and budget. And those 3 things are needed for a complete application. And so this is an example of the proposal submission form. It's an online form, and it's asking information about name and contact information, whether a responder is a tribe or organization, led by BIPOC communities or individuals with disabilities and our LGBTQ individuals, how our responder shares power and decision-making with communities of color, American Indians, disability communities, and our LGBTQ communities, the communities and geographic areas that will be reached, and a description of history and experience relevant to this work, and then the funding amount that is requested. So again, after submitting this online form, you will receive an automated confirmation email, and you should respond to that email with the 2 supplemental materials, which are the work plan and the budget. So this is a screenshot of the work plan template, and you can find this template again on that Community Engagement RFS webpage. And we strongly encourage you to use this Word template, and make note that the work plan should not be longer than 5 pages. And if you do decide to use a different format, just make sure that your work plan includes the following: so a description of each activity, a timeline for each activity, key staff and partners involved, and the estimated number of people reached through each activity. And then this is a screenshot of the budget template. So again, this template can be found on the web page. And if you decide to use a different format, we do strongly encourage you to use the template, but if you do use a different format, the budget should be broken down costs by staff, salary, and fringe, contractual services, mileage and other travel costs, supplies, and any other costs and project-specific administrative costs. So just to reiterate, you should receive an automated confirmation email shortly after you submit your proposal submission form. And if you do not receive that email within an hour, just make sure you check your spam folder, because sometimes it goes there. Please email the work plan and budget, so the supplemental materials, to this email, so the health.covidoutreach@state.mn.us, and just in that email, make note that you submitted the online form but did not receive the confirmation email. And then the submission form, the work plan, and budget should all be received by 11:59 on December 28th. And if you have questions about the RFS or about any parts of the process, please email us at this health.covidoutreach email, and our staff will get back to you within 1 business day. And again, the deadline to submit questions is 5 p.m. on Tuesday, December 22nd. And this is the link to our FAQ webpage, where all the questions and responses will be posted. And we just have a note here about our standard state PT contract template. This template should be found again on this Community Engagement RFS webpage. And we do highly recommend that interested responders take a look at this document, because it sets forth the state standard terms, insurance requirements, procurement laws, and other requirements that have a likelihood to be in the contract with the state if you do get selected. So we recommend taking a look at those contract requirements now. And then now moving on to the review and selection process. So responders will be selected based off their ability to engage communities with culturally relevant, linguistically appropriate, and timely activities to increase community understanding of and engagement around COVID-19 vaccines, testing, and other COVID-19 topics. And so our review communities will represent our priority populations and the communities served by MDH and our partners. And we will review all complete responses, so both the submission form and the supplemental materials that are submitted on or before December 28th. And then after this deadline, if we see the proposals and we're realizing that one of our priority communities is not being reached, the submission process may be reopened and submissions will be reviewed on a rolling basis. And so our scoring system, complete responses will be reviewed using this 100-point scale. And so it's broken down into different categories. So we have history, experience, and qualifications at 20%, the work plan 40%, tribe or organization led by people of color, American Indians, individuals with disabilities, and our LGBTQ individuals 20%. The budget is 10%, and then alignment with state priorities of meeting needs of our priority populations is 10%. So that is all the information that we have today. And I do want to open up the floor to any questions that you all have. Feel free to unmute and ask a question. If you also want to put a question in the chat, we can do that too. I'm not seeing any questions in the chat right now.
Hi, can you hear me?
Hi. Yes, I can hear you.
So I did not hear the amounts that would be given to per organization. Is that determined by the services that we will be providing?
Yeah, good question. So we are asking the range for funding amounts requested is between $10,000 and $75,000.
Okay, thank you.
Welcome. Then, let's see, I'm seeing a question about, will we be able to hire justice impacted people to help reach certain inner city populations? Yes, I think absolutely. We definitely want community members who are most impacted and able to do the work to be hired and represented in staff as well. Bridget and Anne, would you want to add anything else to that?
I think that's absolutely right. Yes, you could hire the best partners to work on your project. And I see the next question is whether the community-based organization needs to be a nonprofit. The answer is no. So for-profit organizations are eligible as long as they are community-led, community-based.
Okay. And then Joanna says, hi, that was really quick. Yes, of course we can. We will be posting the slides on our webpage. We do just have to make it accessible for MDH to put on our website. So we'll get the slides up on our webpage as soon as possible, and this recording as well. And then, can providers leverage external service providers, and should they be identified in the budget or proposal for specific services for printing or video development or translation services? Yeah, so I would say, we would definitely recommend partnering with others to provide specific services, and you can note them in the work plan and the budget. And if you're partnering with another organization, just the lead organization should be the one who's doing the application. Let's see, would a public, oh, go ahead.
Yeah, I was just trying to spare you a little bit here, Ramya. Yes, the next question is, would a public school community education department be eligible to apply, or do you have to be a nonprofit? Yes, that would be an eligible applicant. So again, the question about do you have to be a nonprofit, the answer is no, you just need to be a community-based organization.
And the next question I'm seeing is, we do street outreach to homeless individuals. Is this funding available to fund existing programming? Ann or Bridget, do you want to answer that one?
Yes, so this does not have to be a new project. We just want to see the work that you are proposing for this contract period. If that's a continuation of work that you have already been doing, that's just fine.
And the next one is, what is the admin cap for this funding?
Yeah, so that is a good question. So it's important to note that you cannot have a line in your budget for indirect. You can't just have, an indirect administrative expenses line. But what we are encouraging folks to do instead is to include project-specific administrative costs. So often that looks like allocating those administrative costs according to the project FTE, like this proportion of your occupancy costs or this proportion of your utilities costs. You'll say, okay, because we've got 1.5 FTE working on this project, we're going to allocate that portion of our administrative costs to this project. So I hope that makes sense. So no set indirect rate. You can't include indirect, but you can build those costs into your budget as project specific line items.
Thanks, Ann. The next question is, could you talk about the process of the selection of reviewers? How are you assuring non-biased transparency in this process? That is a really good question. I think I'll just start and give a general overview, and then Ann and Bridget, I'll let you expand. Our selection for reviewers, so we're really trying to reach out to people who identify with our priority populations and trying to find a good mix of both community members and folks at state agencies, so we can have multiple perspectives in our review committee. Bridget and Ann, do you want to add on to that?
Yeah, I think that was a good summary, Ramya. Yep. So after this process is complete, the list of reviewers will be public. So it is transparent in that way. And as Ramya said, the review committee will be comprised of some MDH staff, members of our Minnesota Cultural Councils, Disability Council, and American Indian Council, and then also community partners, who are not applicants. So yeah, really trying to get a good mix, making sure that all of the communities we're trying to serve through these contracts are represented among our reviewers.
And then there's another question about, are for-profit organizations able to apply? And yes, they are. And then how would you define a successful outcome for this study? So I guess it's not really a study. We're really looking to work with you all as experts in your communities and experts in your community needs, and to identify barriers that community members are facing around COVID-19 topics such as vaccines and testing, and partnering with you all to address some of these barriers. So I think success would really, we would let you all define what that success would look like, because we're really looking to you as experts in your community and looking to partner with you all. And then who are the review committee responsible for vetting the organization? So yes, we just kind of briefly went over this. Again, we're a mix of state agency staff, and then really finding people who are representative of our priority populations. So BIPOC communities, disability communities, and LGBTQ communities. And Ann, do you want to answer, can religious organizations with large congregations apply?
Yes, religious organizations, that are community-based and represent these communities are eligible to apply.
And so if there are any other questions, feel free to put them in the chat, or also, you can unmute yourself. and ask the question out loud. I know we did go through the slides kind of quickly this morning, so we will post them on our web page and the recording as well.
So in case any questions come up or we have any sort of a specific, we still have till the 22nd to email it to you guys, right? And then do we get a response back through an email, or do we have to look at the fact page in the administration?
Yeah, that's a question. I think if it's a kind of a simple question that we can find on our RFS web page, you know, we will reply. You'll get a reply immediately, and either that reply will immediately say the answer or will direct you to the FAQ web page.
Thanks.
I have an additional question. If I was to partner with a PCA company that already does some stuff with me, would that be considered a partner? I could use that as a partner?
I would think so. Ann and Bridget, do you have any comments on that one?
Yeah, they could be a subcontractor for you. Yeah.
Okay.
One more question. In regards to the information we're sharing with the people that are the communities that we're in it, are we the content wise, are we creating it, or are we expecting to get that information from the MDH, or how's that communication going to work?
Yeah, that's a really good question. So as we get more information about vaccines from MDH, we do want to partner with community organizations to share these resources and guidance that we're getting from MDH about vaccines specifically to community members. So some of that information, will be provided, MDH guidance as we learn more about vaccines. But then another layer of this RFS is also, learning from you all what the needs and barriers are that you're hearing from community members in order to kind of co-create and address those barriers. So we will, as we gain more information about vaccines and more messaging, we will relay that to you all. Does that make sense?
Yes, thank you.
Okay.
One more while I have you here.
Yeah, of course.
In regards to the work plan, where it says the key staff and partners, if we were using different staff individual for each activity, say we're running a social media campaign or otherwise we're running something different, do we have to list that individual per se, or do you guys wanted one individual just be listed as the key contact person?
Yeah, you can list the main staff. If there's more than one staff working on it, I would recommend listing the main staff, so the multiple people who are working on the campaign on the work plan.
Okay.
Yeah, and of course it's helpful if you can use job titles rather than names, just so reviewers know what you're talking about. Oh, that's their communications director, things like that.
Cool. In regards to geographically where we're located at, so if we are outside the metro area and we have sort of satellite offices, do we list also as far as how far we can reach out to the community, or is that exactly? Or do we just say the headquarters based in metro and then that's our office?
Yeah, I think if you serve populations that are outside of the metro, I would include that. On the submission form, there's a question that asks about geography reach. So if you're reaching folks outside of the metro, I would include that as well. Okay, and again, I just want to open it up to any other questions. Feel free to put it in the chat or unmute yourself and ask the question out loud.
I have a question. As far as documentation of what we're doing, so when we are partnering with another organization, Are there forms that you are suggesting that we use to show the documentation of the partnership and what we are doing?
You know, I'm going to let Bridget and Anne answer that. I'm not sure if there's any specific forms that we're asking for.
Or just an overview report? Are you looking for an overview of the services that we provided?
Okay. Yeah, I would think at the, you know, contractors, we do ask them to provide brief reports and giving an overview of or a summary of what activities have been done. And I would imagine that would include, you know, that we worked with this partner. Bridget and Anne, do you want to add on to that at all?
Yeah, I'm just wondering if you're talking about in your proposal, or if you were selected to be a contractor and during your contract.
Yeah, after we are selected. Yeah, I was just thinking because I just want to be able to say, you know, when I partner with these two agencies, that I was like, you know, I would like for you to also show or demonstrate what this is what I'm going to be doing, but I would like for you to do similar or the same with, you know, with what you're, because we're trying to enlarge our territory and enlarge our reach as it relates to vaccination, encouraging people of color to do that, you know, to provide literacy or literature around that, you know what I mean? So I think if I'm going to be doing a certain thing, I would want the community-based organizations to be do similar, so we're kind of aligning in symmetry as to how we're approaching this.
Yeah, that's great, and we do definitely encourage partnerships. I would say we would recommend that in your work plan, you clearly lay out the roles of each organization in the partnership, so that then when it comes time to reporting and everything, each organization knows what they're reporting on and what tasks and activities they're responsible for, and then also with the budget, making sure it's clear which expenses are being paid for by which organizations.
Okay.
But we don't need to see copies of a memorandum of understanding or any kind of other agreement between.
Okay, that's good to know. Good to know. All right.
And then I'm seeing another question in the chat that Anne just answered, but for those on the phone, I'll just read it out loud. So there's a question about, can you further define what an organization led by people of color, LGBTQ, et cetera, what does led mean? And Anne just replied saying that, you know, the state will consider an entity led by people of color, American Indians, individuals with disabilities, and our LGBTQ individuals, if the entity is a tribe or at least 51% of the organization's board and leadership identify as one of these priority populations. And are there any more questions? Let's see, the next question is, can funds be used to incentivize vaccinations? You know, so as MDH gets more information about vaccines and what that is going to look like, we would want to work with community partners for you all to share this accurate and timely information about vaccines, but then also understanding kind of main barriers and hesitancy around vaccines. So I think, I don't know if it's necessarily incentivizing, but just sharing timely information about what the vaccine process is going to look like, and then also hearing from you all what are main barriers and hesitancies around getting a vaccine, and working to address that.
This is Mike. I'm the one that asked the question. So what I think I hear you saying is that we should probably not, at least in this round, include any funds to provide incentives like gift cards or things like that to get the vaccination.
Oh,
Right. Yeah, we can't give gift cards to people for getting vaccinated. There might be some activities in your work plan that you could provide gift cards for. So if folks are participating in a focus group so we can learn more about community concerns around talking about, that might be an appropriate context for providing gift cards. But yeah, we can't offer incentives for people to get vaccinated just because of the ethics around that. So.
Okay, and then I'm seeing another question about, can community members be given bus cards for transportation if that is a barrier to getting vaccinated? I would believe so, right, Anne and Bridget?
Yeah, I believe that will be an allowable expense. Yeah, I guess we should give the broad disclaimer that the answers we're providing here are kind of our initial spontaneous answers, right? So we will take this back to our team and consider. So please do check our FAQ page in the next day or two for the full and final answers to all of these questions. But our initial thought is that yes, that would be an allowable expense.
And then the next question that I'm seeing is, do you have perceptions of regions that are now underserved that you would encourage focusing in on? Are there known gaps? Let's see. I'm not 100% sure. I think, we're, wanting to partner with organizations that have worked in their specific communities and have an understanding of the needs that community faces. Bridget and Andy have thoughts on this question?
Yeah, I mean, there are so many regions, right? So many communities. I think as long as you're focusing on the priority communities here, I mean, certainly there are a lot of areas in greater Minnesota that we're concerned about, but also areas in the Twin Cities metro. So yeah, we will look to you for your knowledge of communities and gaps that you're seeing. We know that, we'll be working closely with local public health departments around the state as, vaccines are rolled out here. So really would welcome your knowledge of gaps. And I think we will try with this whole cohort of contractors to reach, a range of regions in Minnesota and communities. But I couldn't tell you that there are, 2 or 3 that are kind of really standing out right now because we just have so many needs, right? So thank you.
And then I'm seeing a question, did I miss if questions would be provided or if they'd be developed after the contract is awarded? I'm not sure if I completely understand the question.
Yeah, so I wonder, and I'd welcome that person to ask the question.
I asked a question. Let me see. I would be provided. Oh, I'm sorry. Yeah. So when we're doing these, it sounds like we're doing kind of information building, right? Like right now, Macklin Holdings does something similar to Ramsey County, but they want to know specific information. So they had like established questions. And I feel like I'm hearing the same thing, that the state or the Department of Health is looking to gather information from certain communities, diversity impacted or deeply impacted communities. So in having these conversations, I'm wondering, do you guys have questions in mind, or is that something that's going to be developed once the agency is awarded the contract?
Yeah, that's a good question. I think, you know, a lot of it will be co-created after the contractors are selected, you know, co-created between MDH, the community partner, and any other partners as we get more timely information about COVID-19. I think, and we hear from you all, those questions and kind of priorities will be co-created.
Okay, thank you, thank you. And the other part of that was about incentives. I'm sorry, my internet, I mean, certain parts of my house is just dead zoned. Did I miss anything about incentives, you know, like participatory incentives?
Yeah, so we did have a question earlier about gift cards for vaccines. And so we can't give a gift card for getting a vaccine, but, you know, given incentives for other focus groups or a learning community or something like that would be more of an appropriate incentive for an activity.
Yes, thank you. That's exactly what I was thinking when I, you know, like participatory, like people logging on, people coming to an event. Yes, yes, exactly. Thank you, thank you.
Yeah, and I just wanted to say, I see another question here about conducting focus groups. You know, will there be a discussion guide provided to make sure that all relevant questions will be asked in the same way across all contractors, partners, and communities? So I just want to emphasize, based on the conversation we've been having here, that this is not a study, right? Like we really value the information that you will be sharing with us. You know, our contracted partners will be sharing with us about, you know, needs you're hearing about in your communities, barriers you're hearing about. But the focus of this request for, you know, proposals, request for services is really engaging communities, providing information, making sure folks have the resources they need, are connected to vaccination and testing as appropriate. So it's less about like a needs assessment, it's less about a study, and it's more like, please get out there and engage, share the information and resources that are existing, and then also share back with us what you're hearing, what's not working, things like that. So not a formal study, not a needs assessment, but just that two-way communication will be very helpful.
Okay, are there any last questions? Okay, well, I'm not hearing anything else in the chat and not hearing anyone else in the webinar. So I just want to thank you all for coming today and learning more about the Community Engagement RFS. As we stated before, we will post this recording and the slides on our website as soon as possible. And as you're looking at the webpage, and if you have questions, please reach out to us and we will get back to you within the one business day. Thank you all so much for attending, and I hope you have a good rest of your day, and wishing you peace and comfort as we finish off these last couple weeks of the year and transition into the next one. So have a good rest of your day and a good rest of the week, everyone. Thank you so much.